Channel 11 News has been telling you for years now about the struggles our local ambulance services have been facing. Tonight, 11 Investigates has learned that struggle is getting even worse, and paramedics from 44 counties just sent a letter to the governor. Channel 11's Alyssa Raymond explains why they say this could impact patient care.
44-year-old male, dizzy with chest discomfort.
During a medical emergency, we call for help.
We want somebody there within minutes.
But our emergency medical services agencies say they need help themselves. Greg Porter is the president of EMS West, which serves 16 counties in western PA.
We're losing people at an impressive rate. And then fast forward to about a year ago, we got a new EMS director.
The new Bureau of EMS director is Aaron Roan. He oversees all ambulance services in the state under the Department of Health.
Very educated, very well spoken, but has a very heavy-handed management approach to how he wants EMS to be run and regulated.
Because of changes by Roan, EMS agencies across the state have sent letters to the governor and the state's acting health secretary. They fear if their concerns aren't addressed, ambulances will have to travel longer distances and response times will get longer.
We're going to see less providers, we're going to see less services. We'll have longer response times in a system that already has some significantly delayed response times.
Porter says the Bureau has launched hundreds of investigations into local agencies, more than ever before. Porter's letter states these investigations are often based on incomplete, unconfirmed, and unvetted information, including reacting to random social media posts. The investigations then have led to restrictions on agencies' operating licenses. Porter says those restrictions put their funding at risk and hurt recruitment.
It takes a system that is already struggling and defined by some as in crisis and really pushes it to the breaking point.
Several chiefs did not want to do interviews in fear of retaliation. That's one reason State Senator Lindsey Williams says she's getting involved.
I used to work for the National Whistleblower Center, so I worked for employees who were in fear of retaliation, and I don't want that for my EMS agencies, so if they're afraid, I'm going to be here speaking up for them.
She says her job is to get the state to listen.
Certainly regulate, certainly make sure we're doing good EMS, but help us bring people into the system, help services succeed, help us figure out innovative ways to create an EMS system that people want to be part of and our community relies on, and not one that builds barriers.
Senator Williams is currently working on scheduling a meeting with the health department to discuss these concerns. Reporting in Ross Township, Alyssa Raymond, Channel 11 News.
Alyssa, thank you. And just yesterday, an audit said the Department of Health needs to do a better job managing money that's distributed to the local ambulance services. It needs to have even more oversight. And the Auditor General says they found these same issues in 2010 and they have not been corrected. Late this afternoon, the Health Department gave us a lengthy statement referencing that audit, saying, quote, "We have heard the concerns raised by regional EMS council leaders, and we are committed to work with them to help improve accountability by implementing common sense procedures to ensure that funds they receive are appropriately spent." We put the full statement on our website, WPXI.com.